I'd love to answer this question, so I'm gonna do it again. I chose emergency medicine because it is one of the best fields in the world. Every single day that I walk into the hospital, I am excited, I'm scared, I'm nervous. I feel a strange sense of comfort in the chaos. I get to use my hands and do procedures to save people's lives immediately at the bedside. I get to do things to make people feel better immediately. I have the strange privilege of seeing people in the most chaotic, awful, worst periods of their lives and have an actual chance at making an impact. Shift work is amazing. You get there, you take over the patients, you take care of the patients for your 8 or your 12-hour shift, and then you sign out the patients and you leave at the end of the day and you don't get any texts or questions or complaints afterwards. You get to work with some of the best personalities in the business. People are comfortable in the chaos. People, make crude jokes. People love what they do, and you have this camaraderie with your nurses, your RTs, coworkers, that only we have seen the worst and the best of humanity, and we have this special connection now. I think EM sometimes gets a bad rep from other consultants because, there's the saying of jack of all trades, master of none. But the truth is that the emergency medicine physician is the master of resuscitation, is the master of airways, is the master of managing the patient that comes in with acute illness. Whatever the illness may be, the acute phase of that is kind of where we succeed and we have our general prowess. Of course, there are things that no EM physician will ever be comfortable with. And I think that's, the smaller the human gets, or the more pregnant the human gets, or the more like chronic the patient gets. But we are experts in managing, the airway, the crashing patient. And that is really, really exciting to me. In contrast, I will say my sister is a gynecologist, and she would say that her favorite thing about her job is her, like, one, I'm sure, like, she loves to operate. Two, she would say that the patients, they're just so sweet and so loving and so kind, and they appreciate her every step of the way. I can't say that about our patients, but I can say that it is one of the most rewarding fields in a different way for different reasons.